بسیار خرسند هستم که امروز فرصتی را نصیب شدیم تا روز مبارزه با یکی از امراضی را که در لیست یکی از 10 مرض عمده کشنده شامل است در وزارت صحت عامه با هدف تجلیل کنیم که پیام نهایی تقدیر تمام تلاش های او تعداد از پرسنل صحی و غیر صحی همکارای ملی و بین المللی ما که در این امر ما را کمک کردند مورد تقدیر و تشکر قرار بگیره. مسئولیت کلان را که هنوز هم بر دوش رسانه ها، بر دوش وزارت صحت عامه، شرکای کاری ما و خانواده ها گذاشته است او را برجسته بسازیم. در ظاهر امر شاید یک توبرکلوز ادای واژه‌اش، ادای نامش آسان باشه، ولی به اساس آماری که نزد وزارت صحت عامه ثبت است با وجود محدودیت هایی که سال قبل به دلیل شیوع ویروس کرونا داشتیم، 9800 افغان به دلیل ابتلا به توبرکلوز جانای شیرینش خود از دست دادن. یعنی حد وسط 3 برابر آماری که ما به دلیل از مرگ و میر ناشی از کرونا ثبت داریم. بیش از 50,000 واقعه در افغانستان با وجود پاندمی که موجود بوده، محدودیت عمل موجود بوده، در افغانستان شناسایی شده. در طی 20 سال گذشته کارها و تلاش‌های بسیار زیاد صورت گرفته. توسعه مراکز تشخیص، متدهای تشخیص، استفاده از تکنولوژی جین اکسپرت که نه تنها ما را در بحث توبرکلوز کمک میکنه، هم در قسمت دقت تشخیص و هم تشخیص اون واقعات از توبرکلوز که در مقابل ادویه مقاوم هستند. در زمان کرونا هم اینمی تکنولوژی و اینمی سیستم تانست که ما را در مراکز مختلف مخصوصا در افغان ژاپن کمک کنه. در پهلوی تجلیل و تقدیر از تلاش های او تعداد از عزیزایی که در مبارزه با توبرکلوز با ما همراه بودن، امروز قسمی که رسانه های محترم شاهد بود موږ د 15 کال نوې 15 کال لپاره د همکارۍ سند د امریکای د سفارت او د روغتیا وزارت ترمنځ امضا کړ. د توبرکلوز په برخه کې مختلف ډونرونه او تخنیکی نهادونه دي چې روغتیا وزارت سره مرسته کوي، په شمول د جاپان سفارت، د امریکای سفارت، USAID، WHO، نړیوال بانک، GIZ او یو تعداد نور UNDP مؤسسات. خو د امریکای سفارت او USAID د طریقه یو د هغه مؤسسات او نهادونه دی د هغه انسټیټیوشنونه دی چې روغتیا وزارت سره په مختلفو څانګو کې مخصوصا د توبرکلوز یا نری رنز د مبارزې په برخه کې زیات مرسته کړې ده. دا تفاهمنامه یا تفاهم لیک امضا په ترڅ کې د دوی تعهد مالی مرسته او تخنیکی مرسته د نوې 15 کال لپاره بلا تمدید شي. هیله مدادی حدث مدادی چې د موجوده منابعو د مؤثر، شفاف او هدفمند استفاده په ترڅ کې وشو کولای چې نری رنز ناروغانو د لپاره د درملنې امکانات د هیواد په کچه مخصوصا محروم ولایاتو او ولسوالیو په کچه پراخو او د هغې ترڅنګ عامه پوهاوي په برخه کې مؤثر کارونه وشي او د ټولنې او د مربوطه ادارو مرسته په دې برخه کې ځان سره ولرو ترڅو نوې کال کې بیا 9800 نور افغانان د داسې یو ناروغۍ له کبله چې پام ورته په ټولنه کې متاسفانه ډیر کم خو مړینې کچې ډیر زیات دی بیا د لاسه ورنکو. زموږ ټول تمرکز اوس په ټولنه کې پر زړه ناروغیو باندې، پر سرطان، د وینې فشار او امثاله هم باندې دی. خو نور امراض، ساری امراض دي لکه نری رنز چې متاسفانه زموږ ستي د نږدې کسانو نه یوازې چې ژوند نیسي خو د یو تعداد زیات نورو افغان وګړو هغه د اجرایي او د ژوند خوند او ظرفیت متاسفانه محدودوي. مننه له ټولو نه، رسنیو نه خاص مننه لرم او توقع مې دا دی چې د عامه پوهاوي په برخه کې د روغتیا وزارت سره خپل هغه دینی، مسلکی او ملی مسئولیت ادا کړي. خدای مو ساته. ښه ورځ تاسو ته غواړم.
Mr. Ross Wilson.
Good morning, everybody. and notice Mumbai. The new year is a great occasion for this virtual ceremony. Tuberculosis statement of partnership between the United States and the Afghan Ministry of Public Health. I'd like to thank Dr. Manchu, as well as the team from the National Tuberculosis Program and the Stop TB Partnership for their leadership and dedication to ending this disease here and in the world. Today's statement of partnership establishes a 5-year commitment, part of our enduring partnership with the people of Afghanistan that continues and will continue to collaborate in bringing quality health services to the people of this country. It provides a way forward to reach global targets established in 2018 by the first ever United Nations high-level meeting on tuberculosis. The last year, we all know, has been one of COVID-19. And I'll take this opportunity to remember Mohammed Nazim Samani, one of the champions of Afghanistan's fight against TB, who recently succumbed to COVID. Even during the pandemic, it's necessary to accelerate our efforts toward ending TB. This disease is the world's leading infectious killer, the 9th leading cause of death worldwide. It takes over 1.4 million lives annually and unnecessarily. We need to redouble our joint efforts to ensure the health system here can deliver timely, reliable, and quality prevention and treatment services for tuberculosis. It's also necessary to tackle head-on gender disparities, stigma, and poverty, and malnutrition that feed this disease, as well as to improve contact tracing, active case finding, and the successful completion of treatment. We believe, and I hope our Afghan partners believe, that today's signing and today the partnership that we are concluding will bring us closer to these goals. We're particularly proud of our agreement to establish and monitor a multi-sectoral accountability framework that will help us to implement this agreement effectively. We look forward, my colleagues and I, to working with the Ministry of Public Health so that together we will end tuberculosis in Afghanistan and in the world. We appreciate that partnership. Thank you for being with us.
It's my pleasure to sincerely thank Mr. Ross Wilson, the Short Affairs of the United States of Afghanistan, for his great remarks, for assuring the Ministry of Public Health of their commitment to fight tuberculosis in Afghanistan and to be with us. So thank you so much once again. The program
in partnership of the international community, particularly in order to put an end to this global epidemic. Thank you very much. عامل اختیار وزارت جلالت مآب سر.
Good morning, everyone. Your Excellency, Dr. Wahid, I'm Acting Minister of the Public Health. Your Excellency, the Deputy Ministers, Your Excellency, Dr. Seema, distinguished officials from the UN, international community, USAID, NGOs, CSOs, ladies and gentlemen. I'm honored to be represent United Nations Development Program in this event and celebrate with you TB Day and also congratulate you on the signing agreement between US and you. I really hope that it will help to fight the TB disease and improve the country. Apologies, I was a little bit late. I would like to take this opportunity to congratulate the leadership of the government of Afghanistan and their political commitment, and especially the Ministry of Public Health, the National TB Control Program, and partners for the effort made so far in the fight against TB. Over the last 20 years, the estimated population having access to TB diagnosis and treatment in Afghanistan has steadily increased in total numbers of health facilities applying DOTS that increased from 10 in 2001 to 2,800 health facilities in 2020. In the global outbreak of COVID-19, the immense challenges to the country health system, it's yet another reminder to the health security and health for the really that are two sides of the coin. As we battle both respiratory diseases, we must synergize our efforts. Among other priorities, to prevent resistant or negative health outcomes, TB programs must continue to provide anti-tuberculosis medication to those already started on care. To free up health workers for COVID-19 response while also reducing TB transmission. TB programs should prioritize continued community or household TB treatment instead of facility-based treatment. In this regard, the National TB Control Program, with the support of UNDP Global Fund and other partners, have been managing to detect over the 45,000 confirmed cases and provided a standard treatment. Moreover, in 2020, 6 multi-drug resistant TB wards were functional with the support of partners to provide services. These new facilities mean that patients from these regions no longer have to travel to Kabul for treatment, as they will receive these life-saving services closer to their homes and thus strengthening the treatment success rates. However, what we are doing, unfortunately, it's not enough. The ending TB requires more concentrated multi-sectoral response and innovative approaches to address the social and economic determinants of the diseases, including how women are needed more affected with the TB has a support in the treatment. The impact of the disease on the returnees, migrants, and refugees with the aim to reduce inequalities. Thus, UNDP Afghanistan is committed to work alongside the government of Afghanistan with the sister of UN agencies and all other partners to address social and economic factors through a comprehensive approach of policy, program, and capacity development support to ensure equal right and access to services for all, leaving no one behind. We are here to support you and make sure that Ministry of the Health and in the population of Afghanistan have a proper treatment. Thank you very much again, and congratulations with the TB Day and then assessment. Thank you. Thank you. Have a good day.
به نام خداوند آزادی و برابری. جناب محترم دکتر صاحب مجروح، سرپرست وزارت صحت عامه، مسئولین وزارت صحت عامه، نمایندای سفارتخانه یا ملل متحد، شعبات مختلف ملل متحد، همکاران ما در توقف توبرکلوز، خانم ها و آقایان، صبح همگی شما بخیر. امروز ما روز جهانی توبرکلوز تجلیل میکنیم که همگی ما میفهمیم که در نتیجه تلاش دانشمند بزرگ رابرت کوخ عامل مرض کشف شد و ما تانستیم که شیوه های کنترل یا شیوه های تداوی، تشخیص و تداوی توبرکلوز آغاز بکنیم. البته تمام انسان ها به شمول ما. میخوایم بگوییم که از تلاش خستگی ناپذیر کارمندان ملی توبرکلوز یا پروگرام ملی توبرکلوز و هیئت رهبری وزارت صحت عامه و کارمندانی که در نقاط مختلف افغانستان کار میکنند سپاسگزاری بکنم و تشکری بکنم که با وجودی که شرایط بسیار سخت بود در سال گذشته، تمام سال 2020 پاندمیک کووید همگی ما را، تمام دنیا را به چالش کشانده بود، اما کارمندان بخش توبرکلوز در نقاط مختلف افغانستان موفق شدن که 46,000 کیس جدید یا واقع جدید توبرکلوز کشف بکنن و 420 واقع مقاوم توبرکلوز کشف بکنن و تحت نظارت و تداوی قرار بدن. همچنین از همکاران بین المللی، کسانی که در رابطه با تشخیص و تداوی و رسیدگی به مریضای توبرکلوز افغانستان کمک کرده، تشکری میکنم. که از جمله ما میتونیم از گلوبال فند نام بگیریم، از WHO نام بگیریم، جایکا کمک کرده. سال گذشته ما همیشه در عین روز تقریبا شاهد بودیم که ژاپن همراه وزارت محترم صحت عامه قرارداد امضا کردن و همراه WHO برای پروگرام توبرکلوز بر افغانستان. USAID و خود وزارت مالی افغانستان که مجبور است کو فایننس بکنه وقتی پول را که گلوبال فند میته، از همه زیاد تشکری بکنیم به خاطر تلاششان در رابطه با محو کردن توبرکلوز در افغانستان. دوستای عزیز، همگی ما شما میفهمین دسترسی به خدمات صحی با کیفیت و دسترسی داشتن صحت یک حق حقوق بشری است و ما در این راستا باید تلاش بکنیم که مردم ما از حقوق ابتداییشان که حق دسترسی به خدمات صحی با کیفیت است دسترسی پیدا بکنند. بنابراین ما به خاطر محو توبرکلوز در افغانستان تنها کارهای وزارت صحت عامه کافی نیست، ضرورت است که همگی ما با وزارت صحت عامه همکاری بکنیم. به مو خاطر هم همکاران توقف توبرکلوز که یک نهاد مستقل است یا یک نهاد غیر دولتی است، صرفاً برای دادخواهی از وزارتخانه و افراد متعهد به محو توبرکلوز در افغانستان همکاری میکنن و تلاش میکنن. تشکری بکنم. ما به نمایندگی از همکاران توقف توبرکلوز از تمام دوستان تشکری میکنم و توقع میکنم که همگی در این راستا تلاش بکنن تا ما فقر در افغانستان محو نکنیم، توبرکلوز هم نمیتونیم محو بکنیم. بنابراین ارتباط فقر و توبرکلوز و مسائل دیگه صحی بسیار با هم مرتبط است و در این راستا تلاش همگی ما و وظیفه همگی ماست. تشکر از حوصله‌مندی شما.
Today I'm representing the head of the WHO country office. My name is Muhammad Akhtar. I'm the program manager for communicable diseases and also for non-communicable diseases. But my particular focus is on tuberculosis. Ladies and gentlemen, Your Excellency, the Minister of Public Health, Dr. Mahajur, Head of Stop TB Partnership, Dr. Seema Samar, government and international partners, media representatives, distinguished ladies and gentlemen. Good morning. Many of us, these spring days after Nowruz are the days of revival and renewal. Unfortunately, for many Afghans suffering from tuberculosis, these remains to be days of continued suffering and unease. The theme of the World TB Day, The Clock is Ticking, is a reminder that the world is running out of time to act on the commitment to end TB made by the global leaders in 2018. This is especially critical in the context of COVID-19 pandemic that has disrupted essential health services and has also put end TB progress at risk. We cannot let those who need health services down. We need to do more to ensure equitable access to prevention and care. We need to invest now, we need to act now, and we need to build back the health systems that were disrupted by the pandemic in the previous year. On the World TB Day, WHO is calling for action on several fronts to ensure that the commitments made to end TB are achieved and compensate the devastating impact due to COVID-19 pandemic. COVID-19 has made a stark reminder of the importance of the preparedness, and showing the emergency response can't come at the cost of compromising other health services. Since the start of the pandemic till now, the Afghan-Japan hospital, where some of the most serious TB cases were treated, has been primarily focusing on COVID-19 patient, which is rightly so because the country is facing this pandemic as the rest of the world. Disrupting the TB-related health services, similarly, many other TB treatment and diagnostic centers and staff have been supporting the COVID-19 response at the cost of the TB health services. The impact of the approach is already evident. It has significantly affected TB case detection in 2020, with only 46,000 cases being reported, which was less than 13% compared to 2019 and about 19% behind the target that was set for the year 2020. To ensure gains made in the fight against TB are not reversed, maintaining and strengthening essential TB services urgently need to be prioritized. People-centered delivery of TB prevention, diagnosis, treatment, and care services, including through digital technologies, should ensure in tandem with the COVID-19 response. In addition, contingency plans must also be put in place to protect these services from being disrupted in the next emergency, unfortunately, if we are going to face it again. Tackling health inequality is vital to ensure health for all. The COVID-19 pandemic has drawn attention to deep disparities that persist, most of which are being exaggerated and risk widening even further. Access and availability of the health services are two such key issues. For women and children, those coupled with the cultural barrier, security, and limited decision-making power mean a massive disadvantage. With 2/3 of the TB patients in Afghanistan being women and 1/5 children, immediate action and attention need to be addressed to the barrier in the fight against TB. Timely detection of TB cases is another area that requires focus for the endemic. With the estimated 27,000 people remaining undiagnosed each year and unreported to the National TB Control Program, systemic screening for TB need to be scaled up. Using new tools and approaches to reach all people with help to bridge this gap and also ensure preventive treatment could be provided to people at risk. WHO will continue its effort to support the National TB Program and the Ministry of Health through providing high-quality technical guidance and support and ensuring availability of quality-assured anti-TB drugs and diagnostic in collaboration with the Government of Japan and other donors and partners. We will also continue to work with the donors and the health sector partners to ensure continued investment in the TB program, as well as support the strengthening of the private-public partnership and multi-sectoral approaches for ending TB in Afghanistan. Ladies and gentlemen, we know that with the right intervention, we can make a major difference. We know how to end all forms of tuberculosis. Where we have taken strong and proven measures, the number of people suffering from TB has declined markedly. We know today that with this improvement has been achieved due to the free diagnosis and treatment services provided from the commitment of and the efforts of the Ministry of Public Health. However, we still have a long way to go. Continued political will and higher level of investment and support from donors and international community are vital and much needed to finish the job. We need concerted action now by all sectors to provide right services, support, and enabling safe environment in the right place at the right time. We must continue moving forward in implementation of the NTB strategy to not only ensure the quality of services to reach each and every Afghan in the country, but also fulfill our commitments under the UN General Assembly Political Declaration of 2018 to support the country's endeavors to reach not only the goals and targets of NTB strategy, but also of the universal health coverage and the sustainable development goals targets. Today, let us renew our commitments for ending TB in Afghanistan and set an example that challenges are there to be solved and limitations are there to be overcome. Thank you very much.